Just Amar, if you don't mind just explaining to the audience the different infusion clinics and how they operate in Canada. And the reason why we want to ask this question is that I don't think a lot of patients really understand that the infusion clinics are actually separate entities and they don't necessarily coordinate before a pandemic. And just if you could just describe to the audience what they are.
Yes. Thank you, Gil. So in terms of infusion clinics, there are several infusion clinic providers across the country. But it was about 2 or 3 weeks ago that the infusion leaders from the 4 organizations, from Bayshore, from Coverdale, Innomar Strategies, and McKesson Inviva, came together in order to create a national working group. So the idea behind was that so that we can provide the required care or the continuity of care for these patients, and at the same time be able to respond to any of the situation as it may evolve. And also from the infusion perspective, while we are separate companies and we run different programs, in the time of crisis, it's very important that all of us come together in order to share and pool our resources and to be able to respond to the patients and also to the healthcare.
So, David, just to follow up on Amar's comment, I mean, you're the president and co-founder of Cloverdale Infusion Clinics, and you're operating a company, and I just want you to talk about what it's like to actually integrate multiple different companies that are all doing the same things, but before pandemic, they're competitors, and now you guys are working together hand in hand. Just to kind of let us know that process and how that came to be.
Sure, thanks. We've actually always known each other. This has been actually a great opportunity to actually work together and also to validate the processes that we've been doing ourselves. And no time like now with the pandemic facing us. So as was mentioned, we formed a task force last month and we're meeting regularly. So we're comparing our processes and procedures and our best practices against each other's, and all trying to get ideas of how to treat what's going on today, and also preparing us what may come over the next few weeks or months. We know that this is not a short-term issue, but actually the cooperation has been great. It's been on all levels, and the goal is to safeguard our patients, our staff, and our supplies, make sure that we have enough equipment to last through this pandemic. And also our goal is to keep all the clinics open across the country, and if we can't, how can we come up with solutions together? We've even contacted all the provincial health authorities amongst us to make sure that we are designated as essential services so that these clinics will stay open and our staff can work.
Thanks, David. And I just want to know that one of the tasks that the COVID IVD task force is working with all the infusion clinics is to work with the governments to label the infusion networks as essential services. We're supportive of you in that effort. We think it's so important.